So this video is about tight pelvic floor muscles, what causes them, what to do about them. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. When we talk about pelvic floor, most of the times it's a weakness of pelvic floor muscles. And what we fail to pay attention to is you can have, just like with any muscle in your body, that can be weak, it can be tight. So weakness doesn't mean like it's loose. Weakness also comes from tight musculature. Let me give you an example. If a muscle is chronically tight, it gets tired, it becomes weak. So you see that. Now, if there are issues with a specific part of your body, as an example, your brain will change the blueprint of movement around your aches and pains. Great example is, let's say if you have a knee pain, you're going to shift your weight and start walking funny to avoid putting any weight on that. So that's because your brain already is telling the rest of your body, let's not rely on that body part, that knee, that much. Same can happen with any part of your body, and because of different reasons. So another scenario to weakness is due to a lack of performance of that specific joint, which we're not going to get into. It's extremely extensive assessment to see what's going on. But so let's skip that. Let's just say that that body part gets skipped, and as a result of that, there is lack of conditioning, there's lack of practice of the musculature connected to it. So let's say I'm lifting my arm up and about here I start having pain, so my brain knows it before I get to that point of pain. So as I reach that, it shifts my shoulder forward, a different muscle does the lifting, and then it comes right back up and then finishes the move. So over time, the very muscle that stabilizes my shoulder in this example at this juncture doesn't get to do the work. So it becomes weak and deconditioned. So when it comes to pelvis, there's a lot of dysfunction that is happening in the pelvis joints itself, either in the front, in the pubic area, or sacroiliac joints, which are back here. Either at the connection of the lower back to the pelvis, or connection of the hips to, or your thigh bone to your pelvis. So there is a lot of imbalance that is created. There's a lot of tightness that is created that is feeding other issues that are existing. A very common presentation is someone who actually has incontinence. A lot of times their inner thigh muscles are overactive. When they're overactive, they're trying to, that's the brain's attempt to try to stabilize the pelvis by keeping the knees together and keeping the area of the thighs connected to the pelvis a little bit tighter. So it becomes hypertonic, and we won't call it spastic, but for lack of a, that's a common term people use. So you get tightness of pelvis as a result of dysfunction. The treatment has to be geared to what the presentation is. So don't think about pelvic floor dysfunction as, oh, it's everything's loosey-goosey, because it doesn't have to be. And if you have not explored my blogs on my website, please do so. The information is in the description box. This is your opportunity to subscribe to the channel. If you have any questions, contact the office. I'll talk to you on the phone, see what's going on. If I can help you, great. If not, I'll point you in the right direction. Thanks for watching. Take care.